Bismillahirrahmanirrahim. Quote of the day is: do not waste water, even if you are at a running stream. This is the quote by Prophet Muhammad sallallahu alaihi wasallam. My name is Dr. Aamna Khalid. I am PGR Community Medicine. Today, I will present the topic of water pollution and its impact on public health. I will present this topic under the kind supervision of Professor Dr. Saira Afzal, who is Dean Institute of Public Health, Lahore. Learning objectives for today's presentation will be: we will explain the concept of water pollution, classify water-related diseases, the Bradley and the modified Bradley classification, recognize major sources and types of water pollution, discuss health effects of contaminated water, understand water quality standards, which are the WHO guidelines, explain water quantity requirements and scarcity issues, outline key policies related to the water in Pakistan, identify preventive and control measures, and then we will do the practice of MCQs. So, environment is uh, one of the most significant determinants of human health, influencing disease burden, mortality, and quality of life. The key environmental components are water, air, waste, and radiation, so their management is important. Um, Environmental hazards significantly increase the disease burden globally and as well as in Pakistan. Water is essential for sustaining life. The two major dimensions affect population health, which is the water quality and the water quantity. Water quality, if affected adversely, it leads to pollution. It may be contaminated by the pathogens, chemicals, and heavy metal pollution, industrial and agricultural runoff. So this leads to the waterborne diseases. Water quantity, if affected, leads to the scarcity of water, inadequate supply per person, insufficient for hygiene and sanitation, increasing the urban demand gap, and this leads to the water wash diseases. Both of the dimensions contribute significantly to morbidity and mortality worldwide. So this is the Bradley classification, which classifies the water-related diseases. These are the biological causes and the non-biological causes. The biological causes includes the diseases caused by viruses like hepatitis A, hepatitis E. The diseases caused by bacteria like cholera, which is caused by Vibrio cholera, and typhoid caused by Salmonella typhi. The diseases caused by protozoa like amoebiasis, giardiasis, and the helminths, which cause roundworm or the ascariasis. Then there can be aquatic hosts like snails, which are the host for schistosoma. The disease caused by them is schistosomiasis. And the cyclops, they are also aquatic, and the disease caused by them is dranculus. Then the second category is the non-biological contaminants. These can be chemical or the radiological. For example, if nitrates are present in water, they can cause methemoglobinemia, the blue baby syndrome, and the major system affected by the high concentration of nitrates is the blood system. And the second one is the arsenic, which causes skin lesions, neurological damage, cancers, and it affects multiple organs. Lead can cause neurotoxicity, developmental delay, and it affects the nervous system mainly. Fluoride can cause dental and skeletal fluorosis, so teeth and bone are the major things affected by them. Cadmium can cause kidney tubular damage, and it mainly affects the kidney. So these were just a few examples at how some chemicals are affecting our human health. So this is the modified Bradley classification, which is based on the transmission and how the water-related disease is transmitted. So first of all, we have the waterborne disease, which is the route of transmission is fecal-oral. or by the ingestion, for example, cholera, typhoid, hepatitis A and E. So, how can we go for the prevention of waterborne diseases? We have to focus on chlorination and safe water. Safe water should be provided. Then we have water-based diseases, which are caused by the contact with the skin contact of the with the contaminated water, or even the ingestion. For example, the schistosomiasis and the prevention include we have to avoid the contaminated water. Then water-related vector-borne, where the vector breeds in water and due to the bite of that vector or insect, specific disease has occurred like malaria, dengue, filariasis. And the prevention include vector control and we have to remove the stagnant water. Then we have the water wash diseases. These are due to poor hygiene, poor wash strategies, and person-to-person contact can occur. And the examples include trachoma, scabies, and other skin infections. An adequate supply of the water and hygiene are important for prevention. Then the fifth one is water dispersed diseases. These are caused by the inhalation of water aerosols or vapors. For example, Legionella. Uh, this can be prevented by the system disinfection. So these are some specific issues affecting the water sector of Pakistan. For example, this includes deteriorated food, health, and energy security, decreased storage capacity, and inefficient irrigation practices, higher ranking on climate vulnerability scale, stress on sharing the water resources, limited water availability under transboundary effect, lack of equity in water allowances of various canal commands, salt imbalance affecting yields, uncontrolled groundwater abstraction, lack of drainage, and wastewater recycling. So there are a number of issues we have to deal with. This is the GIS risk mapping of Punjab province, which shows different categories of water pollution, ranging from the dark green color, which is marginally safe, and you can see that Sialkot and Gujarat are the only two cities which are coded with these two with this color. Light green color shows the low risk, and orange color the medium risk, and the Bahawalpur and Multan, these are coming, and Lahore even, these are in the medium risk category. And then we have the high risk in the red color, and you can see that some portion of Sargodha is in the red risk area, high risk area. So this is the report or map given by PCRWR. This is the water quality trend in Punjab province. Blue color shows the provision of safe water, and red color is the unsafe water. So you can see that since 2002, although the length of the red bar has decreased, but still it is higher or greater than the blue bar. Even in 2020, we had the more percentage of samples having unsafe water than the safe water. So this is an important thing. So this is a case study that how water pollution can cause different diseases. Like first example is methemoglobinemia, blue baby syndrome, which is caused by the high nitrate levels in the drinking water. And why infants are vulnerable? Because they have the low gastric acidity, which promotes bacterial conversion of nitrate to nitrite, and also they have the low enzyme activity of methemoglobin reductase to reverse oxidation. So the nitrite oxidizes the hemoglobin, it forms the methemoglobin. The carrying capacity of the hemoglobin for oxygen is decreased, and it leads to cyanosis. So cyanosis is the major clinical feature, which is a blue discoloration of skin or mucous membranes. And how we will manage, we will remove the exposure from nitrates, and a methylene blue can be given intravenously in the severe cases, which reduces the methemoglobin back to hemoglobin. So prevention is we have to monitor the nitrate levels. This should be less than 50 milligram per liter, And infant formula should not be made with the tap water or the well water, which is not managed. This is a study done in Rawalpindi, Pakistan, which shows the level of nitrate and nitrite contents in drinking water of selected samples received at the PGMI Rawalpindi Federal PGMI section. So the results have they have shown are that out of the 162 water samples, 153, these are the 94%, and had the nitrate, and 133, that this is 82%, had nitrite contents in the varying concentrations. While 64 samples means 40% had nitrite, and 22% means the 14% samples had nitrite concentrations. These are the more than the Pakistani standards. And these standards actually follow the WHO guidelines. So they concluded that we have a high risk of water pollution by different chemicals or toxicants. Then we have the brain-eating amoeba causing the amoebic meningoencephalitis. Uh, these are the free-living thermophilic amoeba, and they thrive in the warm, fresh water and more than 25 degree centigrade. And I will summarize it that it causes headache, fever, nausea, and which can lead to seizures. And it actually is transmitted through the contaminated water, which enters the nasal passages and enters the brain. And it is not acquired by the drinking water, and it is not transmitted by person-to-person contact. So we have to avoid a nasal exposure to untreated water, and adequate chlorination of pools and water systems should be done. So this is a um, letter to editor written by the students of Aga Khan University, Karachi, that how the cases of rain-eating amoeba were increased in Karachi. This is from 2025, the previous year. And these are the some water quality standards, like physical standards include that water should be clear, there should be no turbidity or the suspended particles, it should be colorless, odorless, acceptable taste, temperature appropriateness. Then the chemical standards are that arsenic should be less than 10, nitrates less than 50, lead less than 0.01 milligram, and fluoride ranging from 0.5 to 1.5. The microbiological standards are that it should have no E. coli per 100 ml of water, and no fecal coliforms, and absence of all the pathogenic organisms. And the radiological standards are also shown that total indicative dose should be less than 0.1. So these are the sources of water pollution that can be the surface water sources, like the sewage and domestic waste, which is untreated waste, household wastewater. And then we have the industrial discharge, which includes the heavy metals, solvents, effluents. We can have the agricultural runoff, which includes pesticides, fertilizers, and nitrates. Improper waste disposal, like open dumping near the water bodies. All of these are the surface water sources. Then we have also the groundwater sources, like the chemical contamination, including the arsenic contamination, which is the natural geological source. Then we can have a pesticide infiltration into the soil, percolation from the fields. And then we can have industrial waste seepage. This is also the underground leakage. Then we can have fluoride from the rock strata, especially in the arid zones. So this is just an example at how chemical pollution is occurring in water. We have focused on arsenic, as we have mentioned earlier that WHO's focuses on this, that arsenic should be less than 10 microgram per liter, and high levels are reported across Pakistan, especially in Punjab and Sindh groundwater. And you can see that chronic arsenic exposure can lead to a range of health effects. It can affect the skin, causing keratosis, melanosis, hyperpigmentation, and skin cancers. Neurologically, it can cause peripheral neuropathy and cognitive impairment. And in the respiratory system, it can lead to lung cancer, chronic cough, bronchitis. If cardiovascular system is affected, hypertension and ischemic heart disease can occur. Reproductive system, if affected, is causing a miscarriage, a low birth weight, infertility, and a urinary system has symptoms of bladder cancer and kidney damage. So this is again the repetition that how skin is affected by the exposure to arsenic. Initially, there is black brown skin pigmentation. This is melanosis, and a hardening of the palms and soles, which is keratosis. This was due to the exposure to arsenic, low arsenic concentrations. But if the exposure is continued, then the skin depigmentation, like the white raindrops, which is leukomelanosis, can occur. Then, if still the exposure is not removed, then there is thickening of the palms and soles, which is hyperkeratosis, and then further it can lead to skin cancer. This is the report by Pakistan Council of Research in Water Resources, PCRWR. The report is from 2023, and they have shown that how different cities have arsenic contamination in their water samples. And you can see that some cities are majorly affected, like Sahiwal, Sheikhupura, Kasur, Jhang, Multan, and Khanewal. These are some of the cities, especially Sahiwal and Sheikhupura, and they have very high concentration, more than 50 microgram per liter in their water samples. So this is again a graph given by PCRWR, again showing the arsenic contamination in the rural areas of Pakistan. So you can see again and that the red bar shows the concentration between 10 and 50, and the yellow bar shows the concentration above 50. And there are samples in Lahore, majorly in Lahore, and then Kasur, also Multan, Bahawalpur, and Gujarat, where we have the water samples having contamination more than 50 microgram of arsenic per liter of water. So this is the map showing arsenic distribution in the groundwater of Punjab. Red color shows the high range, which is more than 100, and you can see that the red color is how widely spread in the map, and it's especially concentrated in the Hafizabad city, where whole of the city is marked in the red color. All right, now we come to the water quantity and scarcity issues in of Pakistan. The minimum requirement, as given by the National Drinking Water Policy of 2009, has shown that in rural areas the requirement is 45 liter or more than it per person per day, and in urban areas the requirement is 120 liter or more than it per person per day. But Pakistan groundwater availability, which is meter cube per person per year, it has shown a declining trend. You can see that in the year of independence, that is 1947, the level was 5,600 meter cube per year. And then in 1951, it has reduced to 5,260. In 2010, it has reduced to 1,038. And then in 2020, it was at 877. In 2025, it's 660 meter cube per year, and if it's projected to 2050, it's expected that the level will be only 575. So we started from 5,600, and we are in 2025, we are left with 660 meter cube per year only. So Pakistan is facing a severe water scarcity issue, especially in the urban slums and arid regions. And 2050 figure shows the projected one. So these are the key dimensions considered to frame the national strategies for water conservation. We have to focus on improving the water productivity and efficiency, and enhance the public awareness that how water has to be saved. Slowing the population growth, effective public-private partnership. These are the key dimensions we have to focus on for the water conservation. So these are the key factors of slow progress towards safe water supply, and these include water shortage, ineffectiveness of the existing water supply model, low and inefficient financial investment, ineffective management of water supply technologies. And this data is again, this figure is taken from the report of PCRWR, and you can see that they have shown the, how our budget allocation for WASH in 2019 to 20 was PKR 157 billion, and overall it was PKR 739 per capita. However, the PKR, the per capita was highest in Balochistan, which was PKR 1872, and it was lowest in Punjab, which is 371 per capita. Uh, this figure shows that Punjab is investing very low in the water, sanitation, and hygiene sector. These are the why this slide was important, because now you can see that these are the financial implications of unsafe water quality, and the water quality treatment, bottled water, improved water source, waterborne disease treatment cost, loss of work, academic and working days. So all of these, once affected, they can lead to more cost than the provision of safe water. So this is the slide showing the thing. And Pakistan's economic survey, this is a survey from 2011, reported that wash-related diseases cost Pakistan's economy about PKR 112 billion per year, over PKR 300 million a day in terms of health cost and lost earnings. Out of this, the cost associated with stomach-related diseases alone has been estimated at about PKR 55 to 80 billion per year. These costs include those borne by the government and the households and the wider economy, like healthcare. As mentioned in the previous slide, that a major national financing gap exists between the current annual wash spending of PKR 80 billion and the requirement, which is 450 billion. So we can, with this gap, we cannot meet the SDG targets by 2030. So the requirement was 450 billion, and we are spending 80 billion PKR only. So the Sustainable Development Goal SDG 6 focuses on safe water. The goal is to ensure the availability and sustainable management of water and sanitation for all. The target 6.1 is that by 2030, universal access to safe and affordable drinking water should be there. And the indicator is that we will see the percentage of the population using safely managed drinking water services. The WHO or UNICEF defines that the access for the safe drinking water should be 20 liter or more than it for per person per day, and from the improved source, it should be available within 1 kilometer home of the person. And the National Drinking Water Policy of 2009 of Pakistan has mentioned the safe water levels, and I have also already given it in the previous slide. And they are focused that they should be available within 30 minutes of the access of the person. So now we come to the different national water policies in Pakistan. The oldest is from the 2005, the National Environmental Policy, which is the water supply on the management, and it focuses on the developing the legal and policy framework for water, increase the coverage of water supply and treatment, establish water quality monitoring and surveillance, promote low cost water technologies, water harvesting, both in the rural and urban areas, artificial groundwater recharge in the arid areas, meter the water consumption and enact the Water Conservation Act, and integrated watershed management. These are the key areas they have focused on. And then in 2009, we came up with another policy, which is the National Drinking Water Policy, and the key objectives were to ensure the safe and sustainable drinking water for all by 2025, cost-effective treatment technologies and the community participation, intersectoral collaboration, and the capacity building. National standards for drinking water quality should be developed. So the behavioral change strategy proposed by this policy was that the safe water, sanitation, and hand washing, these are the behavioral change strategies at the community level. Means we have to focus on these three things. This is again some of the policy frameworks and the implementation status of water policies across different provinces. For example, in KPK, the water policy was developed in 2015, and then they had another Water Act of 2020. And they had a goal of universal access to potable water by 2025, and they decided to increase the ADP allocation to more than 10%. But the status of this policy is that the 43% unsafe water is monitored in different cities, and stronger action is needed in this province. Then in Sindh, they had a drinking water policy in 2017, and the goal was to reduce the waterborne diseases and achieve the SDG 6 universal access. But the status is that 85% unsafe water is present in their different water samples, so their policy enforcement is very weak. In Gilgit-Baltistan, the policy it was actually a draft of 2019. So they also have an unsatisfactory improvement, and immediate action is required. Then Punjab had the latest policy of water policy 2018 and the Water Act of 2019, and the goal was on the sustainable water management and control pollution discharge. But again, the status is 49% safe water and up to 35% in the 2015, and only 14% improvement is seen. So these are some of the strategies for prevention and control of the water pollution, focusing on the individual, community, and the government level. At the individual level, we can focus on the boiling water before consumption, use of the household filtration systems, safe storage in the narrow mouth covered containers, dispense water without hand contact, hand washing with soap before eating and after defecation. At a community level, we can go for sanitation systems and safe latrine use, community level water treatment plants, proper waste management and disposal, surveillance of water quality by local bodies, behavior change communication campaigns. And at the government level, there should be an enforcement of the policies, infrastructure development for water supply, water quality monitoring and surveillance, arsenic, chloride, and other chemicals removal technologies, continuous and not intermittent water supply systems. So this is a recent article from 2025, and they have focused at how AI can be used for the water quality management, and they have focused on the applications, challenges, and prospects of using AI. This review highlighted that the transformative impact of AI, particularly through the hybrid modeling frameworks that integrate AI with technologies like Internet of Things, IoT, remote sensing, and unmanned monitoring platforms. These advances have significantly enhanced the real-time monitoring accuracy, expanded the scope of data acquisition, and enabled the comprehensive analysis through multi-source data fusion. AI facilitates the dynamic early warning systems, precise pollutant source checking, and data-driven decision making. So here we conclude for the today's presentation that water pollution is a major preventable public health challenge affecting the millions globally. Both water quality and quantity issues drive the disease burden, requiring simultaneous attention to both of the problems. And the modified Bradley classification provides a systematic framework for transmission and prevention. Pakistan faces critical challenges: arsenic contamination, intermittent supply of the water, and growing water scarcity. Combined individual, community, and government level action is essential for the sustainable solutions. So now we come to the practice of MCQ. The first question is: a 2-month old infant presents with cyanosis. History reveals use of well water high in nitrates. What is the most likely diagnosis? Option A, fluorosis, B, methemoglobinemia, C, lead poisoning, D, cholera, and E, arsenicosis.
E.
B.
Um,
B.
All right, ESB is the right answer. Question number 2 is: a village reports cases of cholera after drinking contaminated river water. This is an example of option A, water-wash disease, B, water-based disease, C, water dispersed disease, D, water-borne, and E, vector-borne disease.
D.
D.
Yes, D is the right answer. Question number 3: a child develops scabies due to poor hygiene and lack of water availability. This is classified as option A, water-based disease, B, water dispersed, C, water washed, D, waterborne, and E, chemical disease.
C.
Yes, C. Water washed disease. Question number 4. Residents near an industrial area develop skin lesions and cancer due to contaminated groundwater. Likely contaminant is option A. Fluoride, B. Nitrate, C. Arsenic, D. Iron, E. Sodium.
C.
C.
Yes, C is the right answer, causing skin cancers. Question number 5. A water sample shows presence of E. coli. This indicates option A. Chemical contamination, B. Radiological, C. Safe water, D. Fecal contamination, E. Hard water.
D.
D.
Yes, D is the right answer. Question number 6. Intermittent water supply leads to back siphonage and contamination. The best solution is option A. Increase the storage, B. Boiling water, C. Continuous water supply, D. Chlorination only, and E. Filtration.
C.
C.
Yes, C is the right answer. Question number 7. Our household stores water in open containers and children frequently contaminate it. Best preventive measure is option A. Boiling only, B. Add chlorine, C. Use narrow mouth container, D. Increase supply, E. Filter water.
C.
Yes,
C.
C is the right answer. Question number 8. A global initiative aims to provide safe drinking water for all by 2030. This refers to option A. WHO policy, B. National policy, C. SDG 6, D. UNICEF program, E. Environmental Act.
C.
Yes, this is the SDG goal. Question number 9. A patient develops primary amoebic meningoencephalitis after swimming. The organism enters to option A. Oral ingestion, B. Skin penetration, C. Bloodstream, D. Conjunctiva, and E. Nasal mucosa.
E.
Yes, E is the right
E.
answer. Last question is, regions per capita water availability falls below 1000 meter cube per year. This is classified as option A. Water abundance, B. Water safety, C. Water stress, D. Water purity, and E. Water neutrality.
C.
C.
Yes, C is the right answer. This is the key to all of the questions. This is the YouTube channel of Institute of Public Health Lahore, where the presentation will be uploaded. And thank you so much.
Dr. Aamna, it was a wonderful presentation.
Thank you, Dr. Aamna.
Thank you so much.